The Peterborough Drug Strategy is a collaboration of citizens and local agencies committed to reducing the negative impacts of substance use on communities and individuals. Our strategy is a comprehensive, balanced approach built on the 4 pillars of prevention, harm reduction, treatment, and enforcement. This evidence-based approach is informed by local experts, international research, and best practices from around the world. By combining all 4 pillars and fostering communication and collaboration between agencies, organizations, and individuals, we can create a safer, stronger, healthier community. As part of this strategy, we are creating programs to prevent deaths caused by accidental overdoses. Opioid overdoses are particularly deadly. You might think they're uncommon, but in fact, they outnumber deaths caused by motor vehicle collisions. From 2006 to 2010, there were 1,728 deaths in Ontario due to opioid overdoses, with Peterborough ranking 7th highest in the province. In 2012, 44% of accidental overdose deaths were from opioids alone, with an additional 19% resulting from opioids mixed with alcohol. It's important to understand that opioids are not just street drugs. They include prescription pain medications like codeine, oxycodone, hydromorphone, and fentanyl. The misuse of prescription painkillers, especially opioids, is of particular concern in Ontario, where prescribing rates are higher than the national average.
Drug overdose knows no socioeconomic boundary. It could be anybody's son or daughter, it could be anybody's father or mother, so we have to respond appropriately.
By educating emergency response teams, concerned citizens, and drug users in overdose response techniques, together we can save lives. Let's begin with understanding what an opioid overdose is and how it affects the body. Opioids work by interacting with receptors in our brain. The opioids fit into these receptor sites, sort of like a key fits in a lock. What makes opioids potentially so dangerous is that these same receptors ensure we keep breathing. An overdose happens when more and more opioid molecules latch onto these receptors, overwhelming the brain's ability to keep us breathing properly or even at all. Because someone suffering from an opioid overdose may appear to be simply sleeping, it's important to know the signs to look for. Specifically, breathing becomes very slow and shallow, erratic, or has stopped. Snoring or gurgling sounds are made. Pupils become pinpoints. There is a loss of consciousness. The person is unresponsive to outside stimulus. The body is limp. Pulse is slow, erratic, or not there at all. The face is pale and clammy. Fingers and lips turn blue or purple, and the person may also experience vomiting. An opioid overdose deprives the body of oxygen, which can cause vital organs, especially the brain, to shut down. After 3 to 5 minutes without oxygen, brain damage starts to occur, soon followed by death. Fortunately, there is a medication that can temporarily combat opioid overdose symptoms, buying critical time for paramedics to arrive. Naloxone is a competitive antagonist to opioids. It works by knocking the opioids off the brain receptors they've latched onto, allowing the person to breathe again and temporarily reverses the overdose. Naloxone is safe, with no adverse effects other than the withdrawal symptoms associated with removing a person from an overdose state. Since 1996, over 10,000 people have received a second chance because of this medication. If you use opioids or have a friend or family member who does, a naloxone kit is an essential life-saving tool. Every kit should contain 2 1-milliliter vials of naloxone, 2 safety or retractable syringes, 2 alcohol pads, 1 pair of rubber gloves, and 1 educational insert. Keep the kit in a safe, cool spot, and remember, naloxone has an expiry date. If the kit gets used, please remember to request a refill and reach out for support. While naloxone is extremely effective, it is only temporary, which is why it's so important to follow all the proper steps when faced with an overdose situation. First, see if the person is responsive by shouting at them, gently shaking their shoulders, and checking to see if they are breathing. Next, call 911. This step is critical, as without professional medical help, your friend or family member could die. The following steps will buy them the time they need until paramedics can arrive to help you. Once the paramedics are on their way, administer 1 ampule of naloxone. Naloxone is injected intramuscularly, which means you inject into the arm or leg muscle, not a vein. Once naloxone is injected, it's important to start chest compressions and in some cases rescue breathing right away to keep oxygen moving to the person's brain and major organs. To do this, the person must be lying on a flat, hard surface. If you need to move the person to this position, please be mindful of other injuries the person may have, such as broken bones or a head or neck injury. It's important to provide time for naloxone to take effect and also to start CPR right away in case the naloxone doesn't work. Naloxone should work within at most 3 to 5 minutes. You'll know it's working if the person wakes up and is experiencing withdrawal symptoms such as vomiting or headache. Also, keep in mind that the person may be agitated and want to use again, but naloxone is only temporary, so it's important to encourage them not to use again and wait to be seen by paramedics. If there are no signs of improvement, administer a second dose and continue CPR until paramedics arrive. If the person regains consciousness and you are still waiting for paramedics, place them in the recovery position. This is the safest position for them in case they start to throw up or lose consciousness again. Continue to monitor their breathing and make sure they have not returned into an overdose-induced respiratory failure. If they stop breathing, start CPR again until help arrives.
The danger is when naloxone will wear off after half an hour, 45 minutes. When it wears off, he's going to be back in the same situation. So that's why they need to call 911 and we need to take him to the hospital.
When illegal drugs are involved, many people find it hard to trust police and emergency services and are tempted to leave the scene before help arrives. Unfortunately, this leaves paramedics without details that can be so critical in their life-saving efforts. That's why in Peterborough City and County, emergency services, including the police, respond to overdose calls with the focus on saving lives, not making arrests.
The preservation of life is our paramount concern in any matter that we would become involved in as a police service. So, of course, the 911 drug overdose, our concern is that the victim receives the treatment and care that they require to sustain their life and recover. We're not there to lay criminal charges or, in this case, drug-related charges. That's not our focus.
By following these steps, you can save a life. There are also several things you should definitely not do when someone is having an overdose, including inducing vomiting, letting them sleep it off, putting them in a cold shower, injecting them with anything other than naloxone, or trying to wake them by kicking, punching, violently shaking, or burning them. Despite what people might say, in an overdose situation, these actions will not help and could cause further harm. While it's important to know what to do in the event of an overdose, it's also important to know the risk factors and the preventative steps that can reduce the chance of an overdose in the first place. Many overdose deaths occur when multiple drugs are used. When drugs are combined, 1 + 1 doesn't always equal 2. Instead, the effects can multiply, becoming more dangerous than either drug would be on its own. Avoid mixing drugs, including alcohol. If you are mixing drugs, use less of each drug. Your ability to withstand the effect of a drug can be compromised by weight loss, stress, or illness. Also, if you've taken a break from using, even for a few days, your tolerance can decrease rapidly. If you think your tolerance may be lower, it is important to use smaller amounts. Because illegal drugs are unregulated, their strength is unpredictable, and they may be contaminated with other substances. Know your dealer and ask other users about their experiences. If the drug tastes, smells, or looks different, try a very small amount first. Once an overdose occurs, it's impossible to help yourself. Either let someone know you are about to use and leave your door unlocked, or use with a friend without sharing needles or other equipment. If you use opioids, get trained and get a naloxone kit. If you are close to someone who uses opioids, ask them to get a naloxone kit and attend the training with them. By being aware of the signs of an opioid overdose, being equipped with naloxone, and following the 5-step response, you can save a life.